And so this is a little bit of a repeat. But the first piece of this, what we want to be very, very careful about is that we do not overburden the participant or the resident. If somebody's just started to become interested in their health, we don't want to overburden them with lots of forms or goals or too much information. We simply want them to participate in our programs. We want them to dance. We want them to do Zumba. We want them to learn how to prepare foods in a different way. So it's very important that we spend enough time on that to be able to have residents and neighbors feel that they're simply participating. And then during those programs, then naturally we are having discussions around health and the way that we can improve our health. And through that process, people begin to decide that they, in fact, want to set their own goal. And once again, we go back to one of the very, very early slides. It's really important that the individual and the neighbor wants to do that themselves, not that anybody's dictating to them that they must eat so many fruits and vegetables a day or they must exercise so many minutes a day. The person needs to be able to do that, come to that conclusion themselves. And that's what this process is about. Once we've got them to that process, then people are really interested in improving their health. So now we're getting into a stage where we're becoming much more specific about the health goal and the process by which that health goal is established. So to this point, what's happened is we've met somebody within the neighborhood, we've engaged with them, we've helped them along their way by supporting them with their issues that they may have. They've become interested in our programming and within our health programming. They are starting to attend some of our health programs and services, and they're probably getting their family involved as well. And now they've come to us and said, okay, I really want to set some very specific health goals for myself. And so we have a process, and we're very careful not to present this person with a lot of long questionnaires or a lot of paperwork. This is mostly done through conversation. We have a health planner, and you will see that health planner elsewhere on this site. And we work through that health planner with them, maybe not directly, but by asking them questions over a period of time, so we get a picture of who that person is. And so we get a broad family history. Is there diabetes in the family? Maybe there's an indication of heart health, cancer, whatever within the family. We determine whether or not they have what their level of exercise is, what level of stress they have, do they smoke, what's their diet like, and we know coming into this community that most, or if not all, newcomers are under a significant level of stress. So we know that that's going to impact their health. And from that, once we've got that general picture of an individual's health, we are then able to determine the areas that may be the most beneficial for the first health goal or two. So then we use a well-known process to help to set that health goal. And once again, this may not be done sitting across a table with somebody with a piece of paper and pencil. This may be done over a period of time. This is very much an oral community that learns and wants to express itself orally. So we will have these goals, and we will develop these goals over a period of time. But we do use a specific process, and we use the SMART goal process to set this goal. And so to go through this very specifically, let's just use an example. So in this particular case, let's say we've had somebody come to us who wishes to reduce the risk of diabetes by improving their nutritional habits. If that person comes to us and wants to eat better in order to reduce their risk of diabetes or mitigate their risk of diabetes, then we would start a goal. And the first element has to be that it has to be specific. So we are going to, in this particular case, we are going to improve our nutritional habits by increasing the intake of fruits and vegetables. That's how it's going to happen. That's very specific. We know now how we are going to improve our nutritional habits. The second part is, how are you going to measure that? How do you know that you're You've set a goal, and how do you know that you've achieved your goal? So it has to be measurable. So in this particular case, we've said we're going to eat 5 or more servings of fruit and vegetables a day. So now we're going to intake fruits and vegetables, and we're going to take 5 or more servings of fruits and vegetables every day. The third part of the SMART goal is the A. Who's going to do this? And clearly in this particular case, it's pretty simple. The participant who's at risk of diabetes is going to do that. It also has to be realistic. So it's all very well for us to say that you need to eat more fruits and vegetables daily. But in this particular case, and in this particular community, unless those fruits and vegetables are available, and they are available in a way that meets a budget, then it is not realistic. So the fourth part of this is to say the fruits and vegetables will be available locally and within my budget. It's no use setting a goal if it's not realistic, because that's the easiest way to have somebody turn away from this idea of wanting to improve their health. And finally, we need to have a time definition of how long this is going to take. And in this particular case, it was within 4 weeks. So in that very simple process, we now have a health goal. And that health goal, in this particular case, is to improve somebody's nutritional habits so that we mitigate the risk of diabetes. And the goal states very simply, I will increase my intake of fruit and vegetables by eating 5 or more servings of fruit and vegetables daily, which are available locally and within my budget. I will do this at least 5 days a week by the end of the month. It's very, very specific. It's something that I can keep in my mind, and it's something that meets all of the definition of a SMART goal.